My name is Dr. William Maisel. I am director of the Medical Device Safety Institute at Beth Israel Deaconess Medical Center. It's a industry-independent nonprofit organization designed to study the safety of medical devices. Recently, the results of the MADIT CRT trial were announced. MADIT CRT is a very important trial looking at two populations of patients. All patients in the trial had low ejection fraction, less than 30%. All patients in the trial had a widened QRS of at least 130 milliseconds. And patients had class 1 or class 2 New York Heart Association heart failure. That's the milder classification of heart failure. And patients were randomized into two treatment arms. One arm got a conventional implantable defibrillator, and one arm got a CRT, a cardiac resynchronization defibrillator. And the trial was designed to look at this mild heart failure population and see if resynchronization could benefit them. The population in general was already considered ICD eligible. National guidelines for ICD implantation include this population of patients, but these patients would previously not have been considered eligible for cardiac resynchronization therapy. That therapy had been limited to patients with a wide QRS and more severe heart failure, class 3 or 4 heart failure primarily. So this certainly would extend the benefits of the CRT therapy to a larger population. The results that were released suggested that there was a 29% reduction in the primary endpoint, which was mortality or heart failure hospitalization. And so it suggests that even milder heart failure patients could potentially benefit from CRT devices. I haven't seen the final mortality and heart failure hospitalization results spelled out, but if we were to take some estimates of what prior trials have suggested, so imagine that the total mortality is 8% in one arm, 29% reduction would be something around 6% in the other arm. That would be a 25% reduction, for example. So the absolute mortality reduction is probably going to be in the 2% range. Nevertheless, this is an environment where we're concerned about healthcare costs, and so any intervention that can be provided that can reduce significantly heart failure hospitalizations will be an important intervention. Heart failure hospitalizations are one of the most common causes of hospitalizations in Medicare population. In addition, it is by far one of the highest expenditures for the federal government in taking care of patients. Now, it's important to note, not all those patients have a low ejection fraction and not all those patients have a wide QRS, but certainly interventions that can reduce healthcare expenditures and use of the medical system will ultimately be shown to be cost effective. So heart failure hospitalizations cost a significant amount of revenue for the federal government every year, and with the aging of the population, it's certainly going to not only continue, but it probably increase. So interventions that can reduce heart failure expenditures are certainly going to be worthwhile. One of the interesting questions is how much of an effect MADIT CRT will have on the defibrillator market. On paper, MADIT CRT does not increase the number of eligible patients for defibrillators because these patients were all defibrillator eligible to begin with. Nevertheless, I do think it will have a significant impact on the ICD market because there are many patients and many referring physicians who may not be interested in extending their life but are interested in feeling better and staying out of the hospital. So they want to improve quality of life. And so what MADIT CRT does is shows that this type of device, an ICD with CRT resynchronization therapy, has the potential to improve quality of life in addition to length of life. And that's something that really resonates with patients and it resonates with referring physicians.